you did. Where is your question? Right, so if you have read and understood, considering this surgical anesthesia, kindly tell me what is this that you're looking at?
Yes, ma'am. This is, ma'am, intra-abdominal structures showing the intestines, the small
Yes.
intestines, the jejunum and the ileum and associated vessels.
Right, can you please tell me, this blue arrow is pointing at something. What is it?
Yes, ma'am. The jejunal and ideal vessels
This,
arising from the superior.
yes, it's number 5. This blue arrow is pointing at number 5. If you can identify.
Sorry, ma'am, I am not
Okay,
able
it's
to.
inferior
Yes, ma'am.
mesenteric artery. Can you
Okay,
please
ma'am.
tell me the territory of the supply of this vessel?
Yes, ma'am. Inferior mesenteric vessel supplies the distal part of the colon, starting from distal 1/3 of the transverse colon and descending colon,
Yes,
and the sigmoid colon, upper part of rectum.
good. And if there is another vessel, number 6, if you can identify this one, please.
Mhm. Sorry, ma'am, I will come back to this
It's
later.
left colic artery. Can you please tell me,
Yes, ma'am.
left colic artery is branch of which vessel?
It is a branch of inferior mesenteric artery.
Okay, it supplies which part of
It's
the large intestine? Yes.
Yes, ma'am. It supplies the distal 1/3 of the transverse colon and the descending colon.
Okay, can you please tell me what are the branches of abdomen which arise from the anterior surface?
Uh, Sorry, ma'am, I did not get the question.
Branches of the abdominal aorta which arises from the anterior surface.
Yes, ma'am. There are the paired and unpaired branches arising at various
Just,
levels.
yes,
The celiac trunk, which arises,
yes, yes,
yes, celiac trunk, right and left inferior phrenic vessels,
yes.
inferior mesenteric artery, middle suprarenal vessels, and right and left renal vessels, and um, inferior mesenteric artery, ma'am.
Okay,
And the
it's celiac, it's superior and inferior. Already asked you. Okay, can you please tell me what are the anterior relations of abdominal aorta?
yes, ma'am. Anteriorly from above downwards, it has the uh, the neck of the pancreas, the body of the pancreas, then the duodenum, ma'am,
Yes.
third and the first part of duodenum, and sometimes it has anteriorly the transverse mesocolon and the transverse colon and the gut,
Yes.
the small and large bowel gut loops.
All right. And there is splenic vein and renal vein as well. Okay, right. If you can tell me, would you be able to identify which structure is spleen in in this model or in this image?
It's number 50.
Yes, very good. Can you tell me the blood supply of spleen, please?
It is supplied by splenic artery and the splenic vein. Splenic artery is a direct branch of celiac trunk, and
Yes.
splenic vein joins to superior mesenteric vein to drain into portal vein.
Very good. Okay, right. Can you tell me the surface anatomy of the spleen?
Yes, ma'am. The lateral surface of the spleen, it lies in relation to ribs on the left side from 9th to 11th.
11th. Okay. Can you please tell me the structures that you have to keep in your mind while you're doing the splenectomy?
We have to take care of the stale of the pancreas, which
Yes.
is attached near the splenic hilum.
Okay, good. Can you please tell me the course of the splenic artery?
Yes, ma'am. Splenic artery arises from the celiac trunk and it passes at the upper border of the body of the pancreas.
Yes.
Posterior to the stomach, separated by the lesser sac.
Yes.
It lies in the lienorenal ligament and then it terminates after entering the hilum of the spleen after dividing into segmental branches.
Right. Can you also tell me, okay, what are the ligaments which stabilizes the spleen?
There are anterior and posterior leaf of lienorenal ligament and the gastrosplenic ligaments.
All right.
In splenorenal.
Can you please tell me how many parts of duodenum there are?
There are 4 parts of duodenum.
Yes, please tell me.
The first part is intraperitoneal and second, third and fourth part are retroperitoneal.
Yes.
The first part.
And the fourth, okay. Can you tell me where exactly ampulla of Vetta opens? In the duodenum?
It opens in major duodenal papilla after it unites with the major pancreatic duct, which lies on the posteromedial surface of the duodenum around 8 to 10 centimeters below the impact.
Okay, what are the blood vessels which lie posterior to the duodenum? First part of the duodenum.
There is a portal vein and the common bile duct in relation to the first part of the duodenum.
Yes. All right. Okay. Tell me, what are the parts of the pancreas?
Pancreas has head, neck, body, and a tail, and uncinate process.
All right. What are the hormones which are secreted by the pancreas?
Pancreatic gland has exocrine and endocrine functions. The endocrine cells, they are A, B, and D cells. A cells, alpha cells, they secrete glucagon. Beta cells secrete insulin. D cells secrete somatostatin.
What is the blood supply of pancreas?
It is supplied by superior and inferior pancreatico-duodenal vessels and the splenic vessels.
Okay. Right. Actually, it takes its supply from 3 sources. Superior pancreatic and then inferior pancreatic and pancreatic. Okay, right. Can you tell me about the ducts which open, which are?
Yes, ma'am. The main pancreatic duct, it drains tail, body, and the head of the pancreas, which opens into major duodenal papilla. And an accessory pancreatic duct, which drains uncinate process, which opens into minor duodenal papilla on the medial surface of second part of duodenum.
Can you tell me about the vessels which are encountered during the Whipple procedure?
Yes, ma'am. It's the abdominal aorta, superior mesenteric artery, superior and inferior pancreaticoduodenal vessels. So then there is left renal vein.
Yes.
And the splenic vein, splenic vessels as well.
Good. Well went. What do I have next? Yes. Can you please tell me these? Would you be able to identify?
Yes.
Picture A and picture B.
This seems to be an angiogram of
Yes.
intra-abdominal vessels.
Yes.
And most probably, ma'am, it's A is the.
If we can't today, we'll do it tomorrow. Doesn't matter.
Yes, ma'am. Sure, ma'am.
Yeah. Good. You can read and we'll revise next time. Started the time.